side is...
That left side is not moving at all.
No. Oh, that's the best one.
All right. Did it unlock or did it stay the same?
Yes.
Unlocked, right?
Yeah.
Okay, so now we're gonna focus on cranial mobility. Now, this is definitely the stuff I teach in my mentorship. There's 3 areas that we're gonna focus on with the cranium, the skull. So on the skull, we have these things called sutures. So sutures are basically those little openings that if you've seen a skull model and you see like these lines that kind of look like a river, out of those sutures come out these little nerve endings. They're called meninges. Maybe you've heard this as meningitis, for example.
Yeah, that was my first guess.
Well, you're far from it. So these meninges are little nerve projections that come out from the sutures and they wrap around the entire skull, but they impact everything down the body. So we have what we call sagittal sutures, this is the front and back. Then we have the lambdoid sutures, which is the back of the skull. And then we have the sphenoid sutures. So we're gonna test out each one. What I'm gonna be looking for is tissue restrictions between right and left. So I'm gonna go to the most simplest one, which is the sagittal suture. So what I tend to do now, I'm gonna stand behind Julia. I'm gonna run my fingers through her hair, not in a very romantic way. And I try to just kind of bypass her hair just to feel as much skin as I possibly can. I have my fingers kind of clawed onto her skull on the right side and her left. And I'm testing out now her right side, forward and back, just to see how well the skin and the tissues are moving. And then I go to her left side. Ooh.
Yeah, left side is...
That left side is not moving at all.
No. It's like stapled.
Right, so you see how nice and mobile that is? Left one, oof, especially when I go back, is like barely any movement there.
Is that because of the contralateral thing?
Yes and no, but it might has to do a lot also with just the hits that you got from the ball.
The left was pretty brutal. I had to sit down for that one. Yeah.
There we go. So what I'm gonna have Julia do now is, I want you to give me what we call upper cervical flexion, which is basically give me a chin tuck, a little tuck, then upper cervical lateral flexion to her right, kind of right there. Are you okay with this?
Yeah.
Now we're gonna do a little full cervical flexion down right there. So I'm gonna keep her there. Now, I'm gonna have both of my hands and my fingers on her left side. And all I'm gonna ask her to do now is to do yes nods. So tuck down, good. So what I'm doing is I'm pulling her skin backward the moment she starts putting her head down in a yes nod. And 3, very good. Now, go back to the middle. I'm gonna reassess her tissue mobility again, comparing both sides. So here, that is the right, and there's the left. Oh,
It's
still a little
actually
stuck.
Yeah, but it's better.
But it is
I
a
feel
little
like,
bit more mobile.
Yeah.
The more I do this, the more it's gonna get loosened up. Let's take a look now what that did to her neck range of motion. As we're already there, let's see, side bending. Is that tighter, looser, or the same?
This one is probably looser.
Hmm?
This one also looser.
Okay. Rotations.
Oh, that's the best one.
All right. And yeah, flexion extension.
Oh, that's great.
Still a good extension. Now let's go to our trunk. Let's see what that did. Okay, let's check out side bending. Let's go. Really curious about this one. How was that?
Yeah, I think it's better.
All right.
Because like even here, again, like it's...
Yeah, I can actually see you going further too.
Yeah, it's a little bit tight, but it's not as
Not
tight
as
as
tight.
it was like, yeah, like
Very good.
the first one was restricted. Like you're like, ugh.
Nice. So that was a sagittal suture. Let's go for the other 2. Let's go now to the sphenoid suture. The head position is a little weird on this one, but again, I'm gonna check out her tissue restrictions. Now, I'm going to her side, basically above the ear, draw a straight line a little bit more forward, and I'm basically looking where you kind of have like that little hole next to your side, that little soft spot on your cranium. That's where your sphenoid is. So now I'm gonna do the same exact assessment, 2 to 3 fingers on each side, and I'm going to assess the right one. Let's see. Okay. And then this left. And I'm finding her right side is a little bit stuck going backward. So let's see what that does now. Now for the sphenoid, this one's a little bit complex. We have upper cervical flexion, chin tuck. We have rotation to the same side bending opposite side, cervical flexion down, jaw shifted to the left. And now let's do chin tucks. Better. 1, 2, 3, 4, and 10. Good.
Something was popping.
Something was popping. So every time she did a chin tuck, I did a twisting motion of the tissues. So now let's gonna reassess now the tissue restrictions, if there are any. I'm gonna first check her left side. Pretty good. That is a little bit more smoother also on the right side. Let's see what that did now to the neck. Is that better or worse or same?
I think it's same.
Same, right? Not a big deal. Yeah, it didn't really give me much.
Yeah.
So just check trunk rotations. Still good on that left. Still good on the right.
Yeah.
So it didn't give me a big change so far. I see the sagittal sutures were just enough.
That's where I had like the most pain.
Yeah. Now let's check the lambdoid, which is the back of the skull, not under the skull where the suboccipitals are, but we're talking literally on the bone of the occiput. Okay, so let's check out lambdoid sutures. Again, we're going on the occipital bone, not the suboccipitals where the skull meets the neck. We're going on the skull itself. So I'm gonna bypass her hair, which is a lot, like a lion, and I'm going to assess tissue going up and down on the right side. That feels pretty good. Now let's see that left. And going upward on that left, let me just do it a little more clear. Okay. And now on her left side. Yeah, the left side feels a little bit more stuck as opposed to the right. So let's do a Lambdoid suture mobilization. Okay, so Lambdoid suture, I'm gonna keep 2 or 3 fingers on the back of her skull on the left side where I felt a little bit of a restriction, not too much. Let's just see what that does. So, her position, I'm gonna first keep my fingers on that left side. The position for this one is, again, chin tuck, lateral bend away, so it's gonna be to the right, head down, and now shift your jaw to the right. Right there. And the same exact thing, I'm gonna have her do chin tucks, down and up. So every time she nods down, I'm pulling the skin down at the same time. Every time she nods up, I pull the skin up. All right, let's see what that did now. Sorry. Let's see what that did now to her neck range of motion and pain levels. Side bending.
Oh, that feels
Tighter.
that right away is like, oh,
Ooh.
yeah, you see?
I wouldn't even do the rest. Actually, just let me see the rotations.
Rotation is fine.
But the side bending was
But yeah,
not that great.
it's like, whoa, and that's it.
Okay, so let me then do the lambdoid suture on the right, because this one's a little bit difficult for me to feel. If I'm unsure, I just do one side, reassess, then I'll do the other side. So the same thing on the right side, right there, chin tuck, lateral bend there, head down, jaw shifting to the left, and head nods.
Can we blur my face there? Because it feels so weird.
Let's check again. Is that side?
Oh, wait,
That's that
sorry.
side.
Yeah. That's gonna,
Did it unlock or did it stay
Yes.
the same? Unlocked, right?
yeah. That was like
Head rotations?
yeah.
That's a really good one too. Very good.
Mm-hmm.
And let's see trunk twists. Good.
Yeah. I
Still
feel like
good.
it's the same.
Then the top, right?
Yeah, the top was the
Yeah.
great.
Okay,
Like,
so
the big
we're just gonna do the sagittal suture one more time because I don't want her to leave her like this. So let's do that one more time. I'm gonna go with both hands. Actually, I'll go this way. So chin tuck, side bend to the right, head down, and now give me those head nods. 1, 2, 3, 4, 5, 6, 7, 8, 10. 2 more. 1, 2. Good. All right. Even though that was a little too fast, but let's see. Reassess everything again. Still good. That's better.
Yeah.
Yep. Pretty awesome. Okay. And trunk rotations and side bending of the trunk as well.
Yeah.
Still good. Yeah, that's
Closer.
further.
Oh yeah, great.
All right. So far, guys, that was awesome. So far, we did 2 things, well, 3 things. We did visual reset, just to calm her nervous system down. We did some arrhythmic excursion testing to see which side she needs some breathing. And then we did a lot of cranial stuff because I go by her history. She said that she got hit to the right, got hit to the left. So for homework, I would give her, hey, give me lateral opener to the left, 5, 8 breaths. And then before you play volleyball, I want you to give me some sagittal suture mobilizations. But I would like for her to do that not only before she plays volleyball. I want her before volleyball, after volleyball, in the morning, at night, because those tissues have to unlock and stay that way.
Can I do it seated when I'm like
Absolutely.
working,
Yeah.
set up the alarm, I'm like, okay, let's go.
Absolutely.
Yeah?
Yeah. I would say almost on an hourly or bi-hourly basis, do something. If it's not both the expansion and this, do the cranium. An hour later, do the lateral opener. So this way you can fit these exercises in your daily routine that don't take up a lot of time.
Yeah.
I care about frequency. Do one thing every hour, every couple of hours, because that's how we create neuroplasticity, is repetitive exercise to keep things permanent. For now, we're gonna be focusing on these things, but stay tuned, guys. There's gonna be a lot more that I have to do to Julia, especially for her back pain. I may need to do some spinal cord mobilizations or spinal cord neuromechanics. I may need to check out her actual spinal mobility. I may need to check some of her reflexes, deep tendon reflexes. So we got a host of things that I can pick to help Julia. For now, I go by from the top, working my way down. So hopefully this gives her some relief, but also hopefully it helps you guys to get a better understanding of this stuff. And please take a look at my NeuMove Mentorship program where I show all of this stuff in great detail in 12 modules, which is a full year worth of knowledge of how to fix people with brain-based approaches. So I'll see you guys soon. Thank you all very much for watching.
For disclaimer, I'm not going to play. I'm gonna skip
Yeah, you
playing
better not.
volleyball because you gotta take care of yourself. So
Yeah.
as much as I want to, but Dr. Andres Saltas told me to wait a little bit and to get really healed
Yeah.
and then come back. So thank you.
So one week off from volleyball is not a big deal. If you haven't watched this video, I highly recommend that you do, because I do explain a lot of very useful information and practical tools that you can use. So you definitely don't want to miss this out. Watch this next video and I'll see you guys there.